Good morning, doctor. Kindly introduce yourself.
Yeah, good morning, everybody. I'm Dr. Sarat. I'm a reproductive medicine specialist practicing at Indigo Womens Center Chennai.
What is infertility, sir?
Infertility, by definition, if the couple fails to conceive within 1 year of unprotected coitus, we will label them as infertile.
Is infertility a common problem?
10 to 15% of the couples in a general population may face infertility problem.
How long should women try to get pregnant before calling their doctors?
If the woman fails to conceive within 1 year of unprotected coitus, we'll call them as infertile, and those women who are young, in their 20s, they can wait for about 1 more year, and those women who are above 35 years, I would recommend them as early as 6 months itself.
Is infertility just a women's problem?
No, it's not like that. Infertility is a couple's problem. Both the man and the woman are equally responsible for the infertility. In 50% of the couples may have a male factor infertility. The remaining 50%, either the woman has a problem, or in combination with the man, they may have infertility.
Does the position chosen for intercourse affect fertility?
In cases of normosospermia or men with normal sperm count, it doesn't matter. But in cases of oligoasthenospermias, in cases of low sperm counts, probably position may have an impact. In case of regular coitus, the woman will be advised to have a pillow under the buttocks so that the bottom will be lifted up, so that whatever the semen deposited in the vagina, it will stay for a longer time, and we will advise the woman not to get up and walk around immediately after the coitus.
What are the risk factors?
If the man has varicocele, it may lead to male factor infertility. The other known reasons are mumps. If the man is affected by mumps during childhood, he may suffer infertility during his adulthood. And other known reasons are occupational hazards. If a man works in a hot environment like furnaces or drivers, where they are exposed to the heat, may interfere with the spermatogenesis or sperm production, resulting in infertility.
What about smoking and drinking alcohol and caffeine? Are hot tubes really bad for a man? What else can we do?
Yeah, so smoking definitely will affect the quality of the semen. In chronic smokers, the sperm motility and sperm concentrations will be affected. And coming to the alcohol, in mild to moderate amounts, it may not affect the sperm quality, but in cases of chronic alcoholism, the liver derangements may resulting in the increased levels of female hormones like estrogens, which may affect the spermatogenesis. Then coming to the hot water baths, as I already said, the spermatogenesis is very sensitive to thermal factors, and increased testicular intrascrotal temperatures may affect the sperm production. In cases of oligoasthenospermia, the men will be advised to have cold water baths to relieve the thermogenic effect on the testis. Coming to the female factors, I will divide them according to the part of the female genital tract. Regularly menstruating woman, she will be releasing the egg every month and around about in the middle of the cycle, and if woman fails to ovulate during her menstrual cycle, it may result in anovulatory infertility. 30% of the couples may have anovulatory infertility. Then coming to the fallopian tubes. For the woman to conceive, the tube should be normal. The tube should be patent. Then only the sperm will be able to reach the egg for fertilization purpose. If there is any block in the tubes, may result in tubal factor infertility. About 25% of the couples may have tubal factor infertility. Coming to the uterus are otherwise called as womb. So any abnormalities of the womb, like congenital defects in the womb, or abnormal tumors like fibroids uterus or adenomyosis, or any eventuality which will interfere with the implantation of the embryo in the uterine cavity may result in uterine factor infertility. Coming to the cervix, cervix acts as a facilitator for the sperms to move or swim up to the upper genital tract. During the ovulatory period or in the mid-cycle, the cervical glands will produce copious amounts of cervical mucus which is thin, watery, and which will facilitate the sperms from the vagina to the upper genital tract. Then once the ovulation happens, what happens, the cervical mucus will become thick and tenacious which will interfere with the movement of the sperms or any other foods. No? So, cervix plays an important role in female reproduction. Yeah. Sometimes some women may have antibodies for their husband's sperms. This particular scenario we'll call it as immunological infertility or cervical factor infertility. By bypassing the cervical barrier, procedures like intrauterine insemination or assisted reproductive technologies may be of help for these particular couples. Then coming to the vagina, any factor which will interfere with the normal deposition of the sperms in the vagina, vaginal cysts or congenital anomalies of the vagina which may interfere with the normal coitus may result in the vaginal factor infertility.
How often should we have an intercourse?
Usually after the coitus, the sperms will be there in the female genital tract for about 48 to 72 hours time. So to match that one, if the couple have coitus at the frequency of 2 to 3 times a week, usually it will be sufficient for the couple to have the pregnancy.
What time of the month is the woman most fertile?
Yeah, as I already said, in a regularly menstruating woman, usually mid-cycle or the 14th, around 14th day of the cycle, they have maximum fertility because they will be ovulating this particular time.
Can a woman tell when she ovulates?
Some women may experience abdominal pain at the time of ovulation. We will call this as Mittelschmerz. Subjecting the woman for transvaginal ultrasound guided follicle maturation study. We will follow up the dominant follicle till the ovulation takes place. This is the more scientific method of finding out ovulation. The other methods include the LH surge. Before ovulation takes place, there will be a surge in the LH hormone which will facilitate the rupture of the follicles and ovulation happens. To find out this LH surge, urine can be tested for LH hormone so that we will be able to know the time of ovulation. 24 hours after LH surge, ovulation will happen so that we can guide the couple to have the coitus during that particular period of time to facilitate the sperms to reach the site of fertilization.